So this section corresponds to the initial visual overview. Mycobacterium tuberculosis, an obligate aerobe and acid-fast bacilli, initiates infection following inhalation into the lower respiratory tract. Unlike most bacteria, its lifestyle is defined by intracellular persistence and slow replication. So our target here isn't trying to smash and grab. MTB is launching us long-term infiltration and siege. The goal is not instant destruction, but survival inside the very system designed to eliminate it. Now look into the bottom right-hand set. So here we could see a mycolic acid tank and steel armor. The unique cell wall morphology is key to its resilience. It features a dense mycolic acid layer rich in long fatty acids. This creates a waxy hydrophobic barrier that is virtually impermeable to gram stain and many common antibiotics. This layer is often referred to as organism steel armor. Also visualized is RNA polymerase, the target of critical anti-TB agents. So this isn't an unarmored infantry. MTB is a tank. Its mycolic acid outer layer is heavy steel armor plating, making it resistant to standard weapons, dyeing and acidic environments. Standard entry tools won't cut it. Top right panel, scenario A, are granuloma breakdown. So MTB's primary virulence is its ability to evade destruction and persist. This image specifically highlights granuloma breakdown, a major virulence outcome that occurs during reactivation. Reactivation leads to active tissue destruction, allows the bacilli to multiply uncontrollably and escape, converting a controlled state back into a destructive infection. The inability of the host to maintain control is what causes the breakdown. Story and pathophysiology of MTB. The process begins with an infected person coughing, aerosolizing small 1 to 5 micrometer microscopic droplet nuclei containing MTB bacilli. These droplet nuclei travel to the deep lung, entering the alveolar space. The bacteria are immediately recognized and engulfed by a resistant sentinel cell, the alveolar macrophage. So here in the far right panels, you could see granuloma formation and phagocytosis. The visual flow splits into immune response mechanisms. Phagocytosis. Once inside the macrophage, MTB uses specific proteins to physically inhibit the infusion of phagosome with enzyme filled lysosome. So by blocking lysosome fusion, the bacteria avoid digestion and survive. The host response organizes around the infection. The central cases necrosis is surrounded by a dense layer of activated macrophages, which in turn is ringed by a perimeter of T cells. This structure walls of bacteria, creating a state of latent infection within the pulmonary granuloma. The outer ring attempts to keep the internal chaos contained. Instead of breaking down into a building, MTB infiltrates the police station, that's our macrophage. Once inside the holding cell, the thief doesn't try to escape. He blocks the door, so the SWAT team with the incinerator cannot get in. As his copies multiply, the cities build a steel reinforced container, that's our granuloma, around the whole station. So they cannot kill him, so they try to keep him isolated behind heavy walls. The initial section with droplet nuclei suggests sample collection. Diagnosis relies on capturing the organism. High-yield medical diagnosis utilizes sputum microscopy like a Zell-Nelson stain, especially detects the red stains, AFBs, visualized as purple dots in image. Culture on Lowenstein-Jensen medium, slow 3 to 8 weeks, or rapid nucleic amplification tests, NAT. Preventive measures focuses on containing the latent state as seen in granuloma formation panel. If the T cell or macrophage wall is strong, the disease is dormant. Prophylaxis is administered precisely to prevent the granuloma breakdown seen in the top right scenario, keeping the latent state from transitioning to active disease. Far right inset, treatment. Treatment for this complex organism requires a multi-drug cocktail, the right therapy, visualized as distinct colored spheres. The inset highlights how these drugs function by targeting essential bacterial components like RNA polymerase while also penetrating the steel armor of mycolic acid layer. So, because of this thief is hiding inside a reinforced container, are ripe drugs rifampicin and what is that? God, I forgot. So rifampicin. Okay, so do refer the drugs so that I open the book. So, yeah. So that is it. So treatment is basically like a prolonged siege. You must starve him out using multiple different tactics simultaneously to cut his power and breach his defenses. If you end the siege too early, the thief just waits, recovers, and launches a fresh break-in that is even harder to stop. So it's really important for the patients affected by TB to take in the complete treatment, finish it off, and then continue with their daily activities. And do read Apurva. There are a lot of other important points left out over there for us to, grasp. So this is just to understand the concept and remember a few basic points. However, to replicate the answer in the sheet, we will definitely have to read through the book. So, yeah, happy learning.